Right. Good evening, every person here that takes time to come in.
Yeah.
Let's do it together and give a round of applause to Mr. Lee, who is covering the topic of type 2 diabetes. Mr. Lee, over to you.
Today's topic is about diabetics. Basically, it's very prevalent, especially in the Asia-Pacific region. In fact, Southeast Asia is epicenter of diabetic incidence. Okay, so you look at it itself, how prevalent, as I said, right? First of all, I think you can see that China and India in this chart here show they have the highest number of diabetic patients in the world compared with the European side as well as the US side. As you can see that the numbers in China and India is almost 3 times the uh, the incidence of diabetic compared with the population of diabetics in USA. And if you look at it, on the prevalence in terms of the age itself, most of diabetic patients actually falls in the category of 50 to 70 years at this stage, right? So in here, you have the statistic from Singapore as a reference. There's not much of a big difference between males and females in terms of diabetics incidence, although that I would say that the males are slightly higher at the older age compared with the female, right? But on average, Singapore actually is reported to have about 10.5% of the adult population having diabetes. So it's quite a high proportion. So today we're going to talk about diabetic, and we're going to talk about what are the risk factors that is affecting the diabetic patient, like affecting us, and at the same time we will look at the risk factor and see what are the ways we can mitigate the conditions. Okay, here you can see that diabetic can be divided into two types. Type 1 diabetics, which is actually a condition whereby that our pancreas is not functioning and therefore does not able to secrete hormones called insulins. The hormones, the insulin is a hormone that actually responsible for our body's glucose absorption and metabolism in the cell in the body. So type 1 diabetes are not the prevalent types of diabetic. You can see this only accounts for about 9% of the diabetic population. The one that's actually most common one is actually type 2 diabetics. Type 2 diabetics actually account for 90% of the diabetic population worldwide itself. And then there's the third type of diabetic that actually only happens during gestation period. That means that when you are pregnant. So this is a small percentage and usually it's a transition stage itself. So let's look at the most common types of diabetic, which is the type 2 diabetic itself. As I say, type 2 diabetic is not due to the malfunction of our pancreas, which is the organ that's responsible for the secretions of insulin. Then insulin is actually its main function is to move blood sugar into the body cell for use as energy. So it's like a switch for our body. When we take in sugar, food that is rich in sugar, we go into our bloodstream, which is the insulin that has opened the door for our body to absorb the sugar and convert it into energy. Now, in problem with the type 2 diabetic patient is that the body is resistant to the insulin function. That means that the insulin, the switch is not effective, right? So the body produces insulin, the pancreas still producing insulin, but insulin is not effective in converting the blood sugar into energy, not effective in making the absorption of the blood sugar into our body. So this is actually the bottom line cause of actually the type 2 diabetic. So the key characteristics of type 2 diabetic actually is not high blood sugar. High blood sugar is common in all diabetic types, but the real key characteristics of type 2 diabetic is that the body is insulin resistant. So there's a lot of implication in this meaning, in this statement. I will explain later. Okay, now how do we detect whether we have diabetic or not? So I think there's some standard diabetic testing markers criteria, and you can see from here that there are three very common diabetic criteria. Glucose testing criteria. The first one, the most common one, is actually our fasting glucose, which is the blood sugar. So this is the one the most common because it's also very often used in a lot of devices whereby you pick your fingers and then you go to blood to test the blood sugar level itself. Another criteria or glucose criteria that we use actually is the 2 hours plasma glucose, OGTT. And the third one, which is usually more commonly used for clinician, is it's called hemoglobin A1C, or in short, HbA1C. This is actually a much more stable, long-term measure of our blood sugar level. So generally, there are readings that actually represent whether that you are falling, your body condition is normal, or you're suffering from pre-diabetic, or you're suffering from diabetic itself. These are all the readings for your reference itself. So when we go and check up and see whether that do we have a diabetic or not, actually usually one or two of these markers apply. Okay, now what are the common symptoms of people who are having diabetes? Okay, so this, of course, the symptoms that I listed here are based on the fundamental mechanism that's causing it itself, but it's not necessarily, only limited to diabetic patient. It can also have other underlying causes that share the same symptoms. But if you have more than 2 or 3 symptoms in this chart here, then it's important for you to raise an alarm and go for a checkup itself. So the first most common symptoms of diabetic patient is actually having frequent urination. This is because diabetic patients have high blood sugar level in the body. Then the body, because of high blood sugar level in the blood itself, the body tries to get rid of the glucose by excreting it in the urine, and therefore that resulting in frequent urination. Now, the result of frequent urination itself leads to dehydration. So therefore, it resulting in excessive thirst. So these two are as a result of your blood sugar level high. So then, if the body cannot make use of the sugar that you take in the blood, and therefore your body will have no source of energy supply, and therefore it will resulting in you feel that diabetic patients very often feel fatigued and are very tired because their body cannot work on cannot actually extract the glucose that they take and convert into energy. Similarly, so if the body doesn't have enough energy, the brain will try to tell the body to increase intake of the food, and therefore increased hunger is also one of the symptoms of people who are suffering from diabetes itself. Now, high blood sugar level can damage the blood vessel. So basically, the consequence of it itself over time is that it can actually damage the blood vessel of your eye, which is actually resulting in blurred vision. You also can actually damaging the blood vessel of the peripheral, your legs and your hands, or that. The most common one is actually those blood vessels that's in our limbs, in our legs itself. And therefore, you will find that if you have a cut, there is a lack of supply to the place where your wound is. So the wound recovery will be slow. And one of the common symptoms of people who are in diabetes is that their wound healing is very slow, or generally very slow. Let's look at the risk factor for diabetic patient. So the first one is actually the age. Age is a non-modifiable risk factor. So the older you get, the higher the chances you will suffer from diabetic itself, right? So in here, you can see that in Singapore, the peak is at 60 to 69. So about 25% of the male population and 20% of the female population are suffering from diabetic at the age of 60 to 69. So it's very high. Well, 1 in 4, basically 1 in 4 old people in Singapore are suffering from some form of diabetic condition. So unfortunately, as you get older, you will have a higher risk of it. Another risk factor that's not modifiable is actually family history. Now, this family history itself, you can see from this table here. This table is very interesting in the sense that you actually focus on the Southeast Asia country and South Asia and Southeast Asia country as well. So you can see from there that Malaysia scored the highest, what they call incident rate of people suffer from diabetic condition that's related to family history connection. Right. So when we talk about family history, it's not just only the genes. Now, when you have people in the same family, generally you also share the same environment in the food and have the same behavior, and therefore that resulting in the increased risk of actually the diabetic prevalence of between the family history itself. So therefore, you can see that Singapore is not far from Malaysia. In fact, Singapore is the second runners-up in terms of that condition. And this is important. That means that your family history, your genes affects you, but also your behavior, your lifestyle have a very true, intricate relationship link to what's the diabetic condition that you're suffering. Okay, now more important and more practical part of it itself is to look at those risk factor that is modifiable. That means we can change, we can control. And this is the centerpiece of our diabetic prevention team. This is the centerpiece itself. So I think if you look at this chart itself, there's only thing that I want to highlight is that a lot of us think that diabetic conditions, primary risk factor is the food we take. Taking sugary food, that will cause diabetic. But reality is that if you look at this chart itself, food, actually a healthy food itself reduces your risk. But food itself is not the key risk factor in diabetic condition. In fact, there's two other group of key factor. One of them, you can see from there on the top here, is sociological factor, which is stress, anxiety, depression, and not enough sleep, insomnia. All these factors are the key factors that have known to contribute to higher risk of diabetic patient. So this is something that is considered quite new for most of us, because a lot of us thought that the key factor is in the food. But the reality is that the stress is one of the key contributing factors. In fact, anxiety, you can look at it itself, the relative risk is actually 2.6 as compared with actually insomnia 1.3. Right, so this is one of the highest risk factor, and it's not actually in the food itself. Now, another group of key factor is the obesity, our body, overweight. Overweight is a key risk factor for diabetic patient, and we will see the correlation and relationship afterwards. I will share with you what are the relationships and how are we dealing with it. So the key things in diabetic prevention itself, actually, we should focus on three parts. One is actually on the psychological level. The other one is on actually our metabolism, which is obesity, weight, metabolism. The third one is on our diet. Then, of course, we will also have to moderate our lifestyle, like smoking, drinking alcohol. But if you look at it itself, relatively, compared with other risk factors, the smoking and drinking contribution to the risk is actually much lower compared with other factors. Okay, let's start with the psychological factor, right? Itself. Start with the food itself first. So the first thing is that why I want to start with the food is because a lot of people say, oh, you take sugary food, then you're going to get diabetes, right? Now, if you look at this study itself, in fact, this study clearly showed that not only sugary food increase the risk of diabetic patient, but actually processed meat and red meat also similarly increase the risk itself. So sugary sweet drink, yes, is one of the contributing factor to diabetic risk itself. But you look at the red meat and the processed meat itself, they are equally high risk or equally significant in terms of their influence to our risk itself. So don't think that in the controlling of food for diabetic patient, you need to control only your sugar intake. this is a fallacy. That means that this is the wrong, what they call understanding. This is the wrong perception of it itself. In fact, meat itself also contribute to the cause of diabetic patient. Okay, what are the food that we should eat then? Right here, you can see from the chart here, right? All the food, the green one are the fruits, vegetable, whole grains. These are what we call the diabetic friendly food. So that means that they reduce the risk of diabetic incidence, the risk itself. So you can take, generally these are healthy food that you can take. There's only one exception is the grain side. The refined grains are the one that increase the diabetic risk, which means that, which is true. A lot of people say you should not take white bread, right? White bread, refined grain, actually it does increase the risk of your diabetic risk. Also in here, you can see from here that I put in the coffee and the whole grain. In fact, coffee and whole grain are shown to reduce the risk of diabetic patient, which is a good news for a lot of coffee drinkers. If you drink coffee, then it actually helps to reduce the risk of diabetic itself. But don't jump into it and drink plenty of it itself. It might have other side effects as well. Okay, now look at the coffee itself, as I mentioned, right? You can see from here that actually the effect of coffee in the reduction of the diabetic risk itself, you only have to take 1 to 2 cups a day. You were able to have the reduction of this level. It's actually quite significant, close to about 25% reduction in the risk itself already. And any amount that's more than that actually doesn't necessarily improve your risk reduction. So therefore, don't have to overdrink it. Overdrink. You don't need to drink a lot of coffee. In fact, you look at this chart here, this line is almost flat. So, all right. So, another good thing is that actually, in terms of while it helps in reducing the risk of diabetic patient, it also for diabetic patient, a lot of them are suffering from kidney condition as well as a comorbidity, right? So therefore, coffee helps in preventing the diabetic kidney function decline itself. So this is also a very important benefit. That means that drinking coffee not only lower your risk of diabetic, but also actually prevent your kidney condition from getting worse if you are suffering from diabetic kidney condition. Okay, now important thing is that in diabetes risk prevention itself, for remission, there's 2 key things. That means that for recovery and reverting the condition itself is 2 things. Diet is one of the key remission technique. So you all must understand. While we're talking about risk reduction or risk avoidance, all the things we're talking about itself, like for instance, the stress are actually risk avoidance. They doesn't reverse your diabetic condition. But that diet is one of the remission technique that is recognized itself. So what are the impact of diet to the diabetic patient? You can see from here, the so-called high glycemic index diet, which is actually the high sugar, what we call our unhealthy diet itself, which is high carbohydrate itself. Actually, the risk ratio is 1.12. Not that significant in terms of its risk increase itself. But on the other hand, the Mediterranean diet, which actually we all recognize as the very standard healthy diet itself, and the DASH diet, which is the diet especially for people who have hypertension, right? The only difference between DASH diet and Mediterranean diet is that the DASH diet focus a bit more on the sodium. That means the salt intake. And in fact, they control more vigorously salt intake in this diet compared with the Mediterranean diet. And hence, for general reference, the healthy diet that we are referring to actually does have a positive impact on reducing the risk of type 2 diabetic itself. Now, it's important, you can see from here, what's the impact? Here, you can see that it not only helps you in your BMI, your weight, it also helps you in your lipid condition, which is the triglyceride. Not only it helps in your glucose, these 3 are actually the diabetic condition, including the insulin resistance measurement itself. So you can see from here, right? But it also helps in weight reduction as well. So healthy diet, not only it helps in reducing your blood sugar, but also it helps in the weight management. Okay, now here is a concept that I want you all to grasp, okay? Now, this is a typical natural history of a diabetic patient's progression, type 2 diabetic progression. Before any symptoms of diabetic condition is been detected for anyone of us itself, the progression towards a diabetic condition generally start with weight gain. After the weight gain, then the person progress to having lipid disorder. That means your cholesterol and your triglyceride all go up. Then after the cholesterol get out of control, then the next stage of the condition generally is that your cholesterol block out all the artery, then you have hypertension. Hypertension, then only you have reached a stage whereby that, you can detect that your blood glucose level start going up already. But you are not up to the level where there's a need for clinical intervention. So we call pre-diabetic condition. But reality is that this is the natural progression of a person that going through the stage of slowly progressing towards diabetic condition. So the first thing that we want to avoid is to control the weight gain, because weight gain is a starting point of a diabetic condition itself. So we are going to focus on two key factors today on the prevention side. One is controlling your weight. The other is controlling your lipid disorder, which means that if you have cholesterol problem, you must manage. If you are able to manage these two, you have a very high chance of preventing diabetic progression. Okay, let's look at the obesity side itself. So this chart shows the correlation between the BMI, which is your obesity index, right, with the risk of diabetic patient. And you can see from here, as you are more obese, your BMI increases itself, your risk of having diabetes itself go up. In fact, the woman actually is at a higher risk than the man in terms of body weight affecting them. That means that the woman is more sensitive to the body weight increase, and it will have a higher risk of suffering from diabetic than the man itself. But the higher the weight, the BMI, the more severe your obesity is, actually the higher the risk is. The risks are quite high. They're quite high. So what are the relative risks of diabetic itself? You can see from here, right? For severe obesity itself, the risk is 22 times. It's very, very high. And so which almost certain that if you are having obesity, your risk is about 4.5 times of those who are not itself. So therefore, this is a direct relationship. So controlling obesity is the key factor of preventing diabetic progression. Okay, what are the risk factors for obesity? So we're talking about obesity, but obesity can caused by many, many things, right? So of course, one of the things that come into mind is overeating and poor diet, right? Our diet causes that. Well, it's not alone. It's not the only one. In fact, if you look at it itself, it's not necessarily the most critical one, although it is the important one. So sedentary lifestyle, lack of exercise actually also contribute to the obesity. We all know, if you don't exercise, you lie down, you laze around, you don't exercise, you are going to get weight gain very fast. So then there's a factor which you cannot change, is the family history, gene itself. It runs in a family. You can't blame it's because of a gene. There's nothing you can do. Right? Then there are medical conditions that can contribute to that. Some people actually do a lot of good things. They control their diet. They actually do exercise, but they still having a problem. Why? Because of medical condition, especially people who are suffering from hypothyroidism. Right? So, example, if you are suffering from hypothyroidism itself, you will tend to have feel to be actually overweight. You have tendency of overweight, but this is a medical condition cause. Have nothing to do with your food or your lifestyle itself. Then medication. Some medication also can actually have side effect of actually causing you to have obese itself, especially steroid. People who are on long-term steroid itself will tend to find that they will have a weight problem. This is because steroid induced weight gain in the patient. Okay, now what is the dietary strategy for obesity itself? Now I give a summary here. I'm not going to go into detail, but I'm going to highlight the key point. So we have said that the meridian diet or the DASH diet is the most healthy one. That the problem is that the time to remission for the weight loss, that means that to use this diet to control and to have weight loss itself is a very slow process. Very often, a lot of people say, I eat this, I have no effect. It's true. It takes a long time. You have to you have to actually have long-term years, over the years, to actually have this sort of lifestyle in order for you to be able to gradually improve your weight. But there are two other very fast, rapid acting diet that you can use if you choose to, or you are in a very obese situation or are in a station that you need to have rapid weight loss. So one of them is actually the intermittent fasting, right, which is quite effective itself. You can go and search for how to do a proper intermittent fasting. However, these are the people that should not go into intermittent fasting. People who are hypoglycemia, which means that low blood sugar. People who have eating disorder and and pregnancy. Right? So these are people should avoid using intermittent fasting for weight loss itself. Another one is actually the famous keto diet. Keto diet. Keto diet actually is a low carb diet itself, very low carb itself. You eat a lot of meat, but protein, but you actually cut down all your carbohydrate as well, right? So it also can actually lead to very rapid results in weight loss itself. But there are a group of people who should abstain from taking this method. Kidney disease, liver disease, again, pregnant ladies, right? So while you want to choose a faster approach to cut your weight loss, you can choose intermittent fasting or low carb or keto diet, but then do be careful about the contraindication for this diet itself, so for safety purposes. Okay, now let's look at another condition, which is the lipid disorder. I mentioned that the starting point of actually diabetes is actually the overweight. Then from there, you progress to lipid disorder. That's the next stage of progression itself. Now let's look at some of the stages itself. For diabetic patient, right, there are this lipidemia prevalence. That means that the lipid disorder prevalence in diabetic patient is actually between 70 to 80%. So this is it's very high. That means a very high prevalence rate of diabetic patient, they are suffering with lipid disorder. This is a very common comorbidity of diabetic patient. If you look at it itself, almost 70% of the diabetic patient, at least 70% of the diabetic patients would have lipid disorder problem, and they would have to undergo lipid, what they call the statin cholesterol treatment medication itself. Right? So you look at here, the risk of suffering from lipid disorder as your body weight go up itself, there's also a very close correlation. Why does the lipid disorder happen? It's because as your body weight increases, you can see that your risk of actually your body actually having lipid disorder go up. So this is the first correlation, which means that starting with a weight, right, your weight increase, then it trigger your lipid disorder. Okay, now the lipid disorder prevalence itself, just another chart to show that you can see from here that if you compare with diabetic patient that have uncontrolled diabetic patient. That means the diabetic patient, their diabetic condition is not under control. Close to 93% of the uncontrolled diabetic patients are suffering from lipid disorder. So this is almost saying that when you have your diabetic condition uncontrolled, it's almost certain that you will suffer another condition, which is lipid disorder itself. So it's a very common condition that comes together with diabetic patient. So when we deal with diabetic patient, you don't deal with one condition. You actually have to deal with multiple comorbidity. Among them, lipid disorder is a very common comorbidity of diabetic patient. Okay, now how do we manage current treatment for cholesterol? What we call lipid disorder is that. So generally, when we look at this, most of us will look at when I have a cholesterol problem. Actually, cholesterol is just one of the measure of lipid disorder, because if you look at it itself, the cholesterol level can be actually break down into three sub type of it. One is total cholesterol measurement. One is the bad cholesterol measurement. One is the HDL, which is a good cholesterol measurement. So there are criteria to define whether that your cholesterol is a healthy cholesterol, at risk, or at a dangerous level. So I think that I leave it to you all to have your own reference. But when you look at cholesterol level of a person, it's not just one reading. Actually, very often you have to look at the detail of it itself, whether your cholesterol level is due to your good cholesterol too low, or your bad cholesterol LDL too high, or the total cholesterol too high. So any one of them can constitute a cholesterol problem. All right. So now at a healthy level, generally, if you go and if you are under in this level, generally, what you do is that you keep your lifestyle intact. Eating low saturated fat intake, low sugar intake, high fiber intake, regular physical exercise, quit smoking, and manage your stress. This is generally the recommended lifestyle for dealing with cholesterol problem. But when your cholesterol is at risk, then there's intervention that comes in. The lifestyle intervention will be actually that your physical activity is also mandated. You need to start doing your exercise. I will explain to you later and show you a chart how important is physical activity in the context of diabetic prevention and reversal of diabetic condition. Right. Now, another one is the intervention is actually on the diet. So therefore, when you are at risk at the cholesterol level here, right, then there's two interventions you need to take in. One is to start looking at having a physical exercise regime. Second is that start controlling your diet. Change your diet, change to the vegetable-based, plant-based diet. Okay. Then if you are at the high level, you should also, on top of what we have recommended in terms of physical activities as well as the diet change, you should seek medical intervention, which means that you should go for the doctor checkup and take medication to control your cholesterol level. Right? So don't think that you can self-manage at this level. In fact, the current medication for cholesterol level are very effective, and generally the side effects are very minimal anyway. Okay, now what are the lipid lowering beverage? It means drinks that can help us to lower and cut our weight and reduce fat. So here, I think you can see that the tea are one of the good source of drink that can help to cut down your cholesterol level. There are black tea and green tea are all equally effective in doing that, right? Generally, I think that in terms of the tea comparison, black tea are probably much more stronger in potency for lowering the cholesterol compared to green tea itself, right? Coffee also. Coffee are beneficial for people who are obese and suffering from diabetic metabolic syndrome. And therefore, we have mentioned that drinking coffee is also helpful on that. Now, what are the weight reductions supplement or compound that you can take if you want to cut your weight and or correct your cholesterol problem, right? So there are four very famous, well-studied natural compounds that we all use in the industry. First one is the red yeast rice, which contains monocholine, which is actually the lovastatin's active ingredient of our statin drugs. So this itself basically is where the statin drug is derived from. So red yeast rice is actually a very common Chinese herb for people who are suffering from lipid disorder. They can take it. But of course, if you are taking the modern medication of statin drugs, then you should avoid taking red yeast rice, because you will actually aggregate, also compound the effects of the function of the function, and you might actually overdose on it. Now, another compound which is very famous is actually the berberine. Now, berberine actually is one of the best studied compound, actually, not only for weight loss in the TCM context, it's also actually as an alternative treatment for diabetic patients, as a adjuvant medication for diabetic patient. Berberine is one of the most studied one, well-studied one. And you can see from here, all the systematic review here have a very strong conclusion of significant potency in body weight reduction as well as in lipid dyslipidemia itself. Then the third one, which is actually very common for us, is actually the omega-3. Now, omega-3, we can actually break down into two. One is the animal, which is the fish omega-3, which is the common omega-3 that we know. Then the other one actually is a vegetable form of omega-3, which actually we very often call it ALA, or alpha-linolic acid, which is actually the vegetable form of omega-3 itself. Both of these omega-3 are effective in lowering your triglyceride level. And of course, I will share with you a comparison of performance between the fish omega-3 and vegetable oil omega-3 in terms of the comparison of performance for various types of cholesterol problem. And then the third one, the fourth one actually is the garlic. Garlic is a very common food, spice itself. And basically, if you can eat plenty of garlic, this is very relevant and helpful for people who actually weight reduction. Garlic is a very effective one as well. And in fact, garlic is been studied, well studied, to able to reduce your bad cholesterol very effectively. Okay, now on berberine here, I will skip this chart. Basically, for people who want to really go into more detail as to how effective is berberine itself, there are many well-studied report now on berberine. In fact, berberine actually have a very potent effects, and it can use as a very potent adjunctive therapy for people who are suffering from diabetic patient. So therefore, these are actually the significant reductions in their insulin resistance, significant reduction in your blood glucose level, as well as reduction in lipid metabolism data. Okay, now probiotic. Now probiotic is not a medication, but probiotic has been well studied over the years. In fact, probiotic has proved to be a very useful supplement for diabetics. Not only that, it's actually effective in terms of glycemic control, right? You can see from here, there's two study, systemic review study here, right? It's also actually effective for lipid disorder, which we are talking about the second stage of actually transition to diabetes itself. Also, actually, probiotic has been studied for its effectiveness to manage your weight, obesity. So the probiotic is always a useful, safe recommendation for people who suffer from diabetic, and it doesn't hurt at all for you to take probiotic, because it actually not only helps in weight control, it also helps in actually lower cholesterol. It also helps in lowering your blood sugar level. Okay, now I mentioned that there's two basic approach to reverse the what we call for diabetic remission. One of the diabetic remission techniques or modality is actually through the food side. I mentioned that earlier, right? Now the other one actually is the physical activities. Now physical activities is the only two effective modality that you can use to reverse diabetic condition, which means that you are not just avoiding the risk of diabetic, but you actually can reverse your condition and normalize your condition itself. Now, here there's a chart showing the relative increase in the physical activities and the relative risk of diabetic drop, relative reduction in risk of type 2 diabetic. The drop is pretty sharp, and this spell that I can tell you that, in fact, physical activities, exercise is more effective than using diet to reverse your diabetic condition. If you really want to actually reverse that itself, medication alone can only stop the progression, but reversing it itself is an exercise. Exercise is one of the very effective means of doing that. Okay, so combining the diet and physical exercise itself, what is the impact? You can see from here for general population, where we are, for most of us itself, if you combine your diet, healthy diet, and a regular physical exercise, actually we can cut our risk of diabetic by more than half. It's a very massive reduction in our risk itself. So basically, if you do these two things itself, your risk of having diabetics are, or virtually you can eliminate them. So therefore, it's very important to take it seriously that if you are having diabetic condition, working on food alone is not good enough. In fact, you should take a serious consideration in doing regular exercise. This is one of the most effective means in reversing your diabetic condition. Okay, now another risk factor that we have mentioned earlier is actually smoking. Of course, smoking increases the risk of diabetic conditions and risk of it. You can see from here, right? Increase the risk of current smoker at about 30 to 40% higher risk of diabetic itself, right? And it depends on number of cigarettes smoked per day. As the number of cigarettes smoked go up, your risk go up itself. Similarly, air pollution is a risk factor. So this is something that we can't really direct control. Air pollution is around us. So therefore, try to avoid air exposure to air pollution because this will contribute to your risk of type 2 diabetes as well. Okay, now what are the strategies to avoid type 2 diabetes as a summary? Summary, you can look at it itself. You look at the odds ratio, which is a risk reduction. So you have action that actually we can reduce the risk or avoid the risk. So reduce the stress, you avoid the risk of that. Maintain healthy weight, right? This is actually quite significant because the mean of these two is about 1.8 risk, 1.8 itself. So other than the stress, healthy weight are the two very important risk avoidance factors. That means that you really need to maintain a healthy weight itself, having good sleep, don't suffer from insomnia, quit smoking, and avoid alcohol. These are all the activities you can do to avoid having diabetic condition risk itself. Now, on those who are already having some risk or condition of diabetic itself, you can do these two things to reduce it or reverse it. So these are the risk reduction technique you can use. You can see from here that the physical activities have the highest odds ratio, lowest odds ratio, which means that it can reduce the risk by more than 75%, which is actually a very powerful technique for diabetic prevention and reversal of diabetic condition or remission. So eating healthy is also impact, but the eating healthy only have about 0.5. If you look at this, that on average of 0.4, the risk ratio, so you have about 60% reduction compared with about 80% itself. But eating healthy is not something that you should what they call forego, although that is also not easy to manage itself. Put it that way, there's a lot of temptation in the food, right? So therefore, occasionally you go and eat a bit of good food. It doesn't hurt, but then this is where the problem is. From the science, you are not supposed to eat that, but then from the life, you don't eat all these things, you have no meaning in life, right? So therefore, this one consider in moderation. So therefore, eating healthy are generally not so effective in the practical sense. But regular physical activities can be enforced, can be implemented, and can be very effective. In fact, I've seen personally all my friends that are suffering from diabetic patient actually have a reversal in the condition. I've seen that. Okay, now we'll look at the omega-3 fatty acid I mentioned, right? So because this is a product that Atomy have, right? So when we talk about omega-3 fatty acid, which is fish oil itself, what is the effects of the fish oil? Actually, fish oil, when you take fish oil, basically we say take fish oil, it helps in reduce your cholesterol. That is true based on this study. If your BMI is obese, that means that if you are obese, your total cholesterol can be effective in reducing your total cholesterol. Omega-3 will reduce your total cholesterol. But the omega-3 doesn't really have much effect on your bad cholesterol lowering, doesn't have much effect on your good cholesterol increase. Right? Remember, it's only effective against your triglyceride level. triglyceride level is another form of cholesterol. So therefore, omega-3 is only effective for obese people who are suffering from high triglyceride level. But if you are not suffering from obesity, that means your normal weight, your weight is managed good, taking omega-3 only helps to raise your good cholesterol. It doesn't have significant effects on lowering down your total triglyceride, and it doesn't have a very significant effect in lowering your bad cholesterol. Right? Although there is some decrease in here, but the real significant effect is that it can help to increase your good cholesterol. So this is for a lot of people who actually are suffering from low good cholesterol condition. So omega-3 are actually quite good in increasing your good cholesterol. Okay? Now let's compare the Atomy omega-3 product. Atomy have two omega-3 products itself. One is the Alaska E omega-3, which is the first one that is launched. Then subsequently, they launched the RTG omega-3. Both of them have different presentation, right? RTG is a smaller soft gel, whereas the E omega-3 are bigger soft gel. But if you look at the amount for intake itself, they actually, you take 3 soft gel for RTG, you take 2 soft gel at a time, one time for E omega. So they amount to the same types of active ingredient, which is 700 mg, right? So there's no difference in terms of dosage if you take based according to the instruction itself, right? Now here, I show you what are the application, right? Omega-3 are good for CVD, for reducing the symptom of depression. Remember, depression contribute to increased risk in your diabetic conditions and risk. So omega-3 is quite effective in reducing depression. So if you're suffering from depression, taking omega-3 is one of the very good supplement approach on that. Reducing the risk of heart attack, and then those people who have high level of triglyceride. Remember, omega-3 fish oil is not effective for LDL. It's only effective for triglyceride. So remember that. So if you are having LDL, you don't hope to take omega-3 fish oil to reduce it. You will not. It will not help. And sometimes people say, why I take omega-3? It doesn't give me effect. You are looking at the wrong types of cholesterol. Okay. Now, what are the precautions in taking omega-3? Based on the recommended dosage you take, if you don't overdose, there's no risk itself. But there are certain areas of people who need to be worried about, right? So first of all, do not take excessive. That means that don't take more than recommended dosage. First of all, I would say. Second thing is that these two groups of people should avoid taking omega-3. One is those who have high bleeding risk itself. So those who are actually currently taking anticoagulant itself, you have to be careful about taking omega-3. You probably do not take the full dosage and take down a bit lower to prevent any risk of bleeding, right? More important is people who have arterial fibrillation. This is irregular heartbeat condition. This is the only condition that I want to highlight is that it's not suitable for people who are taking omega-3 fish oil, EPA, because there are substantial studies who show that EPA can increase the arterial fibrillation and resulting in heart attack. So this is a risk factor, major risk factor for heart attack itself. Okay, all right. So okay, all right. So as far as concerned, I think that these are the study. I leave it for you to have reference. All right. Another product I mentioned is actually the vegetable form of omega-3, which is ALA, alpha linoleic acid itself. Actually, it's a vegetable form of omega-3, right? So in here, the recommended dosage of it itself is also 2 soft gel, 2 capsules per day. So you need to stick to this dosage in terms of application. I share with you the comparison between the two itself. Yeah, this is very important. Now you can see from here that both are actually meant for handling lipid disorder condition. But as I mentioned, the fish oil itself only effective for triglyceride, right? It's not effective for the bad cholesterol. It's not effective for the total cholesterol. In fact, it's only helpful to increase the good cholesterol. But the vegetable form of the omega-3 itself is actually effective across all types of cholesterol. So therefore, if you look at it itself, right, if you are not sure what type of cholesterol problem you have, actually ALA is a safer bet for you, right? Safer bet for you. Although that ALA doesn't have any effect on increasing your good cholesterol. So that is the only exception. But if you look at it, ALA is quite effective on the bad cholesterol, LDL. It's actually have good effect on lowering your total cholesterol itself, right? And you also can lower your triglycerides itself, all right? So therefore, if you compare, right? Another advantage, of course, is the ALA is a vegetable form. So obviously, vegan can take it itself. So therefore, ALA it can be a viable substitute for omega-3 for people who actually cannot tolerate the fish oil. So, okay. Now we talk about another compound that can help in the weight loss as well as your actually lipid moderation. In fact, Atomy have a very good tea, which is called the black tea, because it's so this black tea is not a normal black tea powder. It's not a normal pure tea powder. It is actually a tea extract, which contains very high concentration of the active ingredient, which is garlic acid itself. So one packet of actually the Atomy's pure black tea is equal to you drinking 34 cups of the normal black tea. So it's actually a very high potent antioxidant drink itself, right? So as far as concerned, you don't need to drink a lot. In fact, one packet of it itself a day will be suffice for most of people. And pure tea is a very effective tea for weight loss as well management. Okay, so in here you compare what are the benefits of black tea itself. It can help in glucose control, lipid control, as well as weight loss control. So basically, it applies to all three categories of your diabetic conditions itself. So, and if you look at it, black tea is actually much more effective. There's a study here compared with actually the green tea itself. There's a study here as well. So don't overdrink, remember, because it's an extract. It's not a normal tea powder. So don't overdrink because there is excessive of it itself can be also a risk factor. I have stated here the non-observable adverse effect limit actually of the black tea is 800 milligram per kg body weight per day. So remember, so you do not want to overdose as well for this. Okay, so this is the end of my presentation. I pass the time back to Pauline.